Hi everyone, welcome to the optometriosis. In this video, we can learn about what are the types of refractive errors in eye. We all know that what is refraction. Refraction is when light rays bends and passes through the different transparent structures of the eye to focus on the retina and gives a clear image. Light passes through several transparent structures of the eye before it reaches the retina, and the average refractive power of a normal eye is approximately 60 diopters, and the cornea role is 40 diopter and lens occupy 20 diopter, and it relates variable with accommodation. And in lens, changes shape becomes more convex to increase its refractive power when focusing on near objects. It controlled by ciliary muscles and zonular fibers. Now you can see that pathway. Light enters the eye through the cornea, which bends most of the light. It passes through the aqueous humor, pupil, and reaches the lens. Then lens adjusts its shape to focus the light precisely on the retina, a process known as accommodation. Light finally passes through the vitreous humor and focus on the retinal photoreceptors like rods and cones. The retina converts the light into electrical signals, which travels via the optic nerve to the brain. It is the mechanism of refraction in the eye. Light passes through several transparent structures of the eye before it reaches the retina. Now you can see that pathway of light. First, light rays are entered to the eye and passes through the cornea and aqueous humor, pupil, lens, and vitreous humor, and then focus to the retina. The main refractive surface is cornea. It occurs 65 to 75% of refraction. And second, aqueous humor. It maintains intraocular pressure. It is occupied a minor refraction. In lens, fine-tuned focus for near and far vision, like accommodation. In vitreous humor, it transmits light to retina. Now we can see the types of refractive errors in eye. Emmetropia and Ametropia. In Ametropia, the subtypes are myopia, hyperopia, and astigmatism. Now we can see briefly a detail about one by one. Emmetropia is a state of refraction where the parallel light rays from a distant object focus exactly on the retina. In vision is clear without the need for glass or contact lens. It is a normal and ideal refraction. Ametropia is a refractive error condition. It is defined as a parallel rays of light coming from infinity and focused in front of retina or behind the sensitive layer of retina or in both or one meridian of the retina. And ametropia includes the subtypes. First one is myopia and hypermetropia, and then astigmatism. Myopia and hypermetropia, and then astigmatism. And first topic is myopia. Myopia is also known as nearsightedness. It is a common refractive error of eye where distant objects appear blurry but near objects are seen clearly. And the main definition is it is a type of refractive error in which the parallel rays of light coming from infinity are focused in front of retina when accommodation is at rest. Here the causes of myopia. First one is axial myopia. The eyeball is too long, so the light focus in front of retina. In curvatural myopia, the cornea or lens is too curved, increasing the refractive power. In index myopia, it changes the refractive index of lens. Fourth one is positional myopia. The lens is positioned too far forward. We have to know about what are the risk factors of myopia. First one is genetic. We have to ask a patient for family history. Then prolonged near work reading or screen time or study without breaks. Then lack of outdoor activities and less daylight exposure is associated with myopia progression, and people living in urban living higher prevalence in cities versus rural areas. Blurred vision at distance, squinting, eye strain or headache, poor night vision in most of the children sitting close to the TV or holding books close are the symptoms of the myopia. There are three types of ranges in myopia. First one is low myopia. It ranges from minus 0.25 diopter to minus 3. It is most common. Second one is moderate myopia. It ranges from minus 3 diopter to minus 6 diopter, can affect my night vision. And in high myopia, it ranges more than minus 6 diopter. The risk factors of retinal complications are: first one is retinal detachments due to stretched retina. Second one is myopic macular degeneration because of abnormal blood vessels or atrophy. Third one is glaucoma, it higher risk due to eye shape. Fourth one is cataract, it may lead to earlier cataract. Here the diagnosis. First we have to check a visual acuity testing with Snellen chart and objective refraction, subjective refraction, and fundus examination. We have to check the retina in high myopia, then keratometry and biometry. The management and treatment, the most common is optical correction. In we already know we have to correct with concave lens for minus. In contact lens we use soft or rigid lens to correct myopia. Second one is refractive surgery. We use LASIK, PRK, SMILE and phakic IOL. In most of the patient are willing to do a SMILE only. And third one is myopia control in children. We have to give atropine eye drops for slow progressions, and orthokeratology overnight lens for reshape the cornea, and multifocal contact lens is used to slow axial growth, and we have to control outdoor activities at least 2 hours per day. It helps to prevent progression. Here the small flow chart to remember the myopia. And second topic is hypermetropia. Hypermetropia is also known as hyperopia or farsightedness. It is a type of refractive error where distant objects appear clearer than near objects because the light rays entering the eye focus behind the retina. And the real definition is it is a refractive state of eye wherein parallel rays of light coming from infinity or focus behind the retina with when accommodation is at rest. Next, causes of hypermetropia. First one is axial hypermetropia. The eyeball becomes too short, and curvature hypermetropia is cornea or lens is flatter than normal. In index hypermetropia, the decreased refractive index of the lens, and in high positional hypermetropia, lens is positioned too far back. Aphakia is also known as absence of the lens. And here the types based on cause or development. First one is congenital. It presents at birth, maybe due to small eyeball or genetics. In acquired after surgery, like aphakia. In simple physiological and most common only. In pathological, it is due to abnormal development. In functional, it paralyzes the accommodation and it mostly rare. Here the symptoms of hypermetropia. In children it occurs due to strong accommodation. In adults the eye strain, headache, blurred near visions are occurred. In elderly person it occurs presbyopia. And here the classification by degree. In low hypermetropia it ranges from plus 0.25 diopter to plus 2 diopter. In moderate it ranges from plus 2.25 diopter to plus 5 diopter. In high hypermetropia it ranges above plus 5 diopter. And diagnosis of hypermetropia, first one is visual acuity for reduced near vision. In retinoscopy we have to done with cycloplegic drops, especially in children, and subjective refraction. In fundus we have to see in a disc, and in biometry for axial length measurement. And treatment and management, first option is optical correction. In specs we have to use convex lens to shift focus on retina. In contact lens we use soft or rigid lens. In refractive surgery we use phakic IOL, LASIK, PRK and LASIK. And if we uncorrect the hypermetropia in children, it can lead to squint, amblyopia, strabismus and eye fatigue from constant effect to accommodate. And third topic is astigmatism. It is a common refractive error of the eye where vision becomes blurred or distorted due to an irregular shaped cornea or lens that causes light rays to focus on multiple points instead of one. In astigmatism, the curvature of the cornea or lens is not uniform, like a rugby ball instead of a perfect sphere. This leads to unequal refraction of light rays in different meridians. It results in blurred or stretched vision at all distance. Causes of astigmatism. First one is corneal astigmatism. It is most common and cornea is curved more in one direction. In lenticular astigmatism, it is less common, caused by irregularities in the lens. In irregular astigmatism, it occurs disease or trauma. The surface of cornea has uneven curvature seen in keratoconus, scars and surgeries. The symptoms of astigmatism are blurred or distorted vision, eye strain or discomfort, headache and difficulty seeing fine details and trouble with night vision or glare. Here the types of astigmatism based on axis. First one is regular astigmatism. The principal meridians are 90 degree apart perpendicular and it correct with cylindrical lens. The subtypes of irregular astigmatism are with the rule, against the rule and oblique. In with the rule, the vertical meridian is steeper and in against the rule horizontal meridian is steeper. In oblique, the axis is between 30 to 60 degree. In irregular astigmatism, the principal meridians are not perpendicular. It cannot be fully corrected by glass. It may need contact lens or surgery. And here the another types based on refractive status. First one is simple myopic astigmatism. It occurs one meridian is emmetropic and another meridian is myopic. Example, we can see here plano with -1 into 180 degree. In simple hypermetropic, the one is hypermetropic, the other one is hypermetropic. Example, plano with +1 into 90 degree. In compound myopic astigmatism, both meridians are myopic. Example, -2, -1 into 180 degree. In compound hypermetropic astigmatism, both meridians are hypermetropic. Example, +2 and +1 into 90 degree. In mixed astigmatism, one meridian is myopic, the other is hypermetropic. Here the example, +1 and -2 into 180 degree. Here the diagnosis of astigmatism. First one is visual acuity test to detect blurred vision, and in keratometry we have to measure the corneal curvature. Third one is corneal topography. It is useful to detect the irregular astigmatism, and we have to detect with retinoscopy, objective and subjective refraction. Here the treatment and management. First option is spectacles to correct the cylindrical lens axis and power, and in contact lens we use toric soft lens, RGP lens, hybrid lens and scleral lens. And in refractive surgery we have to go with LASIK, PRK, SMILE, astigmatic keratotomy and toric IOLs. And if we untreated astigmatism in children, it may lead to amblyopia and it can affect academic performance and visual development. We have to imagine astigmatism in visual analogy. In normal eye, the eye is like a basketball and it equals in curvature in all directions. In astigmatism eye, it is like a rugby ball. It differs the curvature in each meridian. And that's all. Today we learnt about what are the types of refractive errors of eye and causes, symptoms, diagnosis and management and treatment. Let's meet you in next video. Thank you.